let us see the blood clotting cascade, and we'll start with the extrinsic pathway. Extrinsic pathway. Right. Now, extrinsic pathway, it begins with a tissue damage, right? Some sort of damage that occurs to the tissue. And this tissue damage, it releases tissue factors in the blood. TF is called as tissue factors. Okay, now what do these tissue factors do? These tissue factors, they take up factor 3, which is in the inactive form, and convert it into the active form of 3A. Now this one is thromboplastin. It is thromboplastin. Okay, next what happens? Next, this factor 3A, what it does is, it takes factor 7. It takes factor 7 and activates it into 7A. So we are representing the activated versions with the A. Right. Now, this factor 7, it will take factor 10 and activates it into factor 10A. Now, factor 10 is actually 10A is prothrombinase. It's an enzyme called prothrombinase, which is also called as prothrombin activator. It is also called as the prothrombin activator. Now, on the contrary, the intrinsic pathway is a little different. Intrinsic pathway. So what happens in the intrinsic pathway? Intrinsic pathway actually begins with a factor. It begins with another factor called 12. It begins with 12, right? Which this 12, what it does, it converts factor 11 into 11A. Okay, then this 11A, what it does is, it takes another factor which is our factor 9 and converts it into 9A. Right. Now, this 9 combines with another activated factor, which we will write it as 8A. Okay, which is also come from its activation 8. Okay, so this 8A and 9A, what it does, they convert factor 10 into the activated form of 10A. So in both cases, I am having my 10A factor, which is my prothrombin activator. So this prothrombin activator, which is nothing but my factor 10A, which is nothing but my factor 10A, the activated prothrombin activator, it combines with factor 5, and what it does, it converts factor 2 into 2A, right? So 2 is prothrombin and 2A is the activated thrombin, right? Now what happens? This 2A, what it does is, it technically binds to fibrinogen. It technically takes factor 1. Now factor 1 is what? It is fibrinogen, the inactive form. So fibrinogen is converted into the active form of fibrin, right? And this is done by 2A thrombin. But this is again loose fibers, right? So to convert this into strong fibrin, the actual fibrin mesh that is used, you will need another factor, and that factor is factor 30. Right? So as I've told you, the pathways for the extrinsic till here is one set, right? Intrinsic is one set, but everything is merging here in the activation of prothrombin to thrombin, right? So this is the clotting cascade. Now we are going to see what are the names of these clotting factors, and we are going to continue further. So we have seen them. Now we are going to know their names. Factor 1 is fibrinogen. The active form of fibrinogen is fibrin. Then factor 2 is prothrombin. The active form is thrombin. Then factor 3 is thromboplastin, which is the also okay. Then factor 4 are the calcium ions of plasma. When you are converting prothrombin into thrombin, you will require calcium ions. So these calcium ions become the factor 4. Factor 5 is the proacceleratin, which I've told you binds to the factor 10 for the activation of prothrombin into thrombin. Then factor 6 is the sixth one is factor 7, which is the proconvertin. Factor 8 is anti-hemophilic globulin, and in fact it is this factor 8 whose deficiency results in a genetic disorder called hemophilia type A. The gene that produces factor 8, if it is mutated or if there is any deficiency, the amount of factor 8 production will be decreased or completely deficient. In such cases, the individuals will suffer from hemophilia A. Right. So that's why it's called as anti-hemophilic factor, factor A. Then the next one is factor 9. Factor 9 is PTC, prothrombin plasma thromboplastin component, which is also called as Christmas factor or AHFB. And this deficiency of this causes the genetic disorder hemophilia type B. So you have two types of hemophilia. Type A is caused by factor 8 and type B is caused by factor B. Next, factor 10 is Stewart-Prower factor, which is also called as the thrombokinase. The name of it is thrombokinase. Which then factor 11 is plasma thromboplastin accident, PTA. Right. Then you have factor 12, which is called as the Hegman's factor, and factor 13, which is the fibrin stabilizing factor. Okay, factor 6 is no longer referred to as a separate factor. It is the combination of activated factors 5 and 10. Okay, now clot retraction. Within a few minutes after the clot is formed, it begins to contract so that the fluid is expelled out. This process is called as clot retraction. Means once the clot is completely formed, it will become more tight and more compact and contract. So the fluid from the injury is expelled out. This fluid is called as serum, and serum is nothing but plasma without fibrinogen. So whatever plasma is there from the injured site, it will go out, but while going out, this plasma does not have fibrinogen because all the fibrinogen is getting deposited here near the clot. So serum is plasma minus fibrinogen. Okay, now platelets are very necessary for clot retraction, and without failure of clot retraction indicates that the number of platelets are very low, which is seen in the cases of dengue. In the case of dengue, when you have the platelet count falls very rapidly and the patient may require even platelet transfusion. Now, to stop the coagulation process, you require anticoagulants. One such very common anticoagulant is heparin, which is produced by the mast cells and basophil cells. See, only at the site of injury this clot should happen. It should not keep happening throughout the body and everywhere, right? Otherwise, it will become a dangerous condition. So, only at the site of the injury for the and at a specific time only you require coagulation. So where there is no clotting required, you need to have an anticoagulant, which is heparin, produced within our own body. Now heparin, it activates antithrombin, which binds with thrombin and inactivates it. I mean, what it does, prothrombin binds to thrombin, right? But to this thrombin, if heparin is bound, then this one, it cannot convert fibrinogen to fibrin. Okay, another one is coumarins, which are of plant origins, and warfarin is also an anticoagulant. Right, warfarins are antagonistic to vitamin K, thus prevents the synthesis of blood clotting factors 2, 7, 9 and 10 formation in the liver. Warfarin is available in the brand names Coumadin and Xanthovin. In fact, patients who are having brain clots, or if they are having any clots in the body, like in the head or in the heart or various regions, thigh regions, blood vessels, they have clots due to injury. So for that, these anticoagulant drugs like Coumadin and Xanthovin are given, so that when they take it, the clots get broken down. Okay, the anticoagulant is usually used for the prevention of thrombosis and thromboembolism. Embolism is nothing but formation of blood clots in the vessels, and they just keep migrating everywhere because they are in the blood vessel. They can go anywhere, and suddenly if it goes into the brain, it stops a capillary, it stops the blood flow, and you have brain hem. The brain won't get oxygen. If it goes into the heart, it causes heart attacks and even death also. So to prevent that thrombosis and embolism, you will use anticoagulants. At the same time, if you go to your laboratories and if you see that when they take blood from you, they put it in small tube like containers and they shake it. Now those tubes, they are actually coated with EDTA, that is ethylene diamine tetraacetic acid, or sometimes they are even coated with sodium citrates or sodium oxalates. Now what they do is they bind to the calcium ion, these EDTAs or sodium or citrates or sodium oxalates, they bind to the calcium ions, that is the factor 4, and they prevent the process of clotting. Now let us see some MCQs. Which of the following ions play an important role in blood clotting? It is calcium. Right, so this is blood clotting.
For more content, like, share and subscribe to www.i-win.in.